Hi, humans. This is my second in a series of case studies from ancient Chinese medicine books. And this is a case study by a doctor named Sun Yikui. And this Dr. Sun lived in the late Ming dynasty, and he wrote a book of his cases. And some of his characteristics is he's very long-winded. His cases are so long, describing all kinds of stuff in them, and he thinks a lot of himself. This case I really kind of like, but he's bragging about himself and he's putting down a woman doctor, but I think we could also see it from a different perspective. So let's see what he has to say for himself. Um, Let me get my little laser pointer there. Okay. A characteristic of many ancient cases is they brag about how important their clients are because it makes them feel more important. So, of course, this guy, Sunny Quay, who's, to me seems very egotistical, he always is bragging about who he treats. So, the wife of some famous person, the wife of Minister Pan's third son was okay, the third son's wife. Yeah, sorry, maybe I should fix that. The third son's wife was the granddaughter of another really important person. So he's not only bragging about the father's lineage, but he's bragging about the woman's lineage. And she was 25 years old. Her body was constitutionally weak, and her speech was very proper and circumspect. And this is important. Remember this, okay? She became grief stricken because she had difficult childbirth, which had damaged her, worn her out. And then she gave birth to a girl, which, of course, they always wanted boys. And so that was a real disappointment. And then the girl died, which she probably felt guilty for wanting a boy. And then the girl died. Anyway, she was a mess, as you might imagine. Who wouldn't be? So, right when the baby died, she lost consciousness. And when she awoke, her mental state was nightmarish and confused, and her hands and feet convulsed, and her eyes stared straight ahead, meaning, you see in like cartoons or old movies where they wave their hand in front of somebody's face and the person isn't responsive. So, she's like not really, she's only semi conscious and she's convulsing. Sun Yikui, I arrived after the convulsions had begun, so I couldn't take her pulse because she was twitching too much. I carefully inquired about her, and from the time the baby was born, she didn't have any discharge of lochia. So, in case you don't know what that is, after someone gives birth, there's a discharge that in some ways is similar to a menstrual period, but there's more mucus in it, and the word in Chinese actually literally means evil dew. Like that's kind of a horrible name for it. It's considered dirty, very dirty. Menstrual blood also, but this is especially dirty. And it's thought to be important for it to be discharged from the body. If it's not discharged, they call it retention of lochia, and they have formulas to try and make the lochia discharge. So this bad stuff is stuck inside of her. So the family had a female doctor who had been trusted by, the family in the past, and she was there. I want to point out, though, that this doesn't say a midwife, it doesn't say a granny, it says a female doctor. It uses really the word for a doctor, which, kind of shows that she must have had some formal education within her family, or we don't know how, but we don't know her name. But she wasn't just some midwife or granny. I'm not putting down midwives or grannies who do health care. They were necessary, but the male doctors hated any of the female healthcare professionals because they felt it was competition. They felt it was unfair competition because the female the women could go into the women's quarters and the women could tell them things that they wouldn't tell the male doctors, and maybe they were giving, like, abortions, and maybe they were giving birth control, and they just didn't trust them. Plus they had such disdain for women anyway. So okay, we have it's interesting that he called her a female doctor. That shows some level of education. So the family had a female doctor who was there, and from time to time this female doctor had given the woman a lot of ginseng to chew on because, giving birth and losing blood and going through all that effort is really exhausting. And she had a weak constitution to begin with. But of course, he doesn't just say she was giving ginseng indiscriminately, randomly giving ginseng to chew on, as well as dushen tang, which means just decocting ginseng to drink, as well as rice porridge, zhou or juk, which, is considered, very healthy and easy to digest and will help, keep the patient strong for the process of childbirth and recovery afterwards. But Sun Yikui says ginseng and rice porridge both clog the region above the diaphragm and they don't descend. And that's why she was having convulsions, and that's why her spirit was cloudy. So he's blaming all of that on her from ginseng and rice porridge. I don't know. Anyway, so Sun Yikui, famous male doctor, I asked them to induce vomiting by sticking their fingers down her throat because I'm above doing that. I mean, all ancient Chinese doctors wouldn't do those things. They'd have someone else do it. So they're trying to induce vomiting to get rid of the porridge and the ginseng. And so she vomited up a bunch of phlegm room, like turbid fluids and the food and the herbs. And then her convulsions stabilized. Well, it's true that convulsions are frequently blamed on phlegm. So, okay, we don't know if it's really the porridge and the herbs, but at least getting the phlegm out was a good thing. Then Sun Yikui, I gave her Chuancheng, Shanja, Zilan, Chenpi, Bancha Fuling, part of Urchin Tang for the convulsion, no, I mean for the phlegm, and Xiangfu. So she swallowed it and slept a little. If you're watching this video and you haven't studied Chinese medicine and you don't know what these herbs are, just enjoy the story. If you've studied Chinese herbs, then these are pretty familiar herbs. So Sun Yikui did his thing, and then he went out into the central hall to sleep because he was going to stay there since this is kind of a critical case. He was going to stay overnight. Maybe he traveled from afar to get there. So he's staying elsewhere in the compound. And so now he's complaining again about the female doctor. I did not predict that the female doctor would again secretly give her two doses of supplementing herbs. So we don't know if she really gave more medicine or not, but he's blaming her. He blames her for everything. He blames her for whatever he doesn't do right. And so then during, the time period from 11 p.m. to 3 a.m., she was suddenly manic and frenzied. And she was as if the gods had descended into her, and she was a spirit medium, and she was speaking words that don't sound like her. And she identified herself as Guanyin. I am Guanyin descending to the altar. So the way she was talking, though, was very scholarly and refined official speech, or Mandarin, the late Ming dynasty predecessor of Mandarin. she's talking. Remember, before she had very soft and gentle speech, and now she's speaking like an official in a strong official voice in Mandarin, asking questions and answering questions fluently. Her voice was quite strong and formidable, and she wasn't this delicate little thing anymore. She definitely lacked the appearance of postpartum insufficiency. In her whole life, she had never even heard anyone speak Mandarin, but now she spoke like a native speaker. Everybody was so surprised. And so they really thought Guanyin had descended into her. They regarded her as if a god had possessed her and she was a spirit medium now. And they prayed to her in 100 different ways. Guanyin, please help me. Guanyin, I need your assistance for this problem in my life. They were really treating her like she was Guanyin manifest. But I, Sun Yikui, no female can be that important. I alone admonished her. I talked to her about this. I said, this is incomplete discharge of lokia. So this stored up old toxic blood is making symptoms as if you're seeing ghosts. This is not a genuine case of possession by a god or a Buddha. I gently used proper words to rebuke her, and then she fell silent. He couldn't believe that she could possibly be doing this, and he couldn't believe that, he was not in awe of her the way the other people around the household were. So next, I used a formula that's called Qing Hun San, or Hun returning powder. Did I get that translation right? Where is it? No, clear the Hun powder. Sorry, I put the wrong word here. Clear the Hun powder. Okay. And I added some other herbs, huasher and tongbian, child's urine, which was used in the old days. It was detoxifying and heat clearing. It had to be of a 10-year-old boy or younger, pre-puberty. Well, I'm not real excited about using that, but that's what they used. So he gave her these herbs. Dawn arrived and her urine began flowing, so she started urinating, and all the mania and the frenzy stabilized by dawn. I went out of the room for a short while, but who could have expected that this female doctor intended to take credit for all my achievements? I also have no idea what herb she gave the patient. A moment later, the mania and frenzy were as bad as before. So every time she regresses, he blames the female doctor for sneaking her herbs. Did she really give any herbs in between? Well, I don't know. Maybe not. He's just not willing to take responsibility for anything. He's just so upset and agitated that she's even in the house. She can do nothing right, in his opinion. So again, I gave the patient some chuanxiang, some dangui, and some more zilan and imucao, and some more child's urine. And she, took them, and she took 2 packages of it in a row, but it was ineffective. You see, you're not so good. Who do you think you are? So then I had to revise my thinking about it. There still be phlegm at the chest, making stagnation. So in the previous prescription on the previous slide, there were no ingredients for phlegm as an assistant or envoy. And so it just didn't work. And then I gave her the previous prescription, but I added a lot of shanja, cretaceous, which will transform food stagnation in case there's still more of the porridge, and to some degree transforms phlegm and so forth. So her logia started moving again a bit, and her mental state calmed down, and then she was able to sleep. But in a short time, her hands and feet started moving, and sometimes she started slapping her own face and beating her chest. She was probably so distraught about the loss of her child, about that the child was a girl, not a boy, and that then the child had died. And so she was probably just so distraught, and this is her grief. She's not convulsing now, it seems. To me, it sounds like she's expressing her grief. But he says she's in a muddled frenzy. So I examined her pulse. It was getting more and more deficient. In the morning, her face had been red and lustrous. It's good to have some color in the face and some brightness in the face. But by 3 to 7 p.m., her face was white. This was blood moving and fire retreating. Her pulse was deficient, so she needed to be supplemented. I gave her some ginseng. Now he's giving her ginseng. Before he was blaming the woman doctor for giving her ginseng, but now he's giving her ginseng, chuancheng and zilan, and also dangui and more shanja for the phlegm. It seems what he's using, and fuling and chenpi and so forth. Also some huye, the lotus leaf. This juan means rolled up. Okay. So these were all boiled and mixed with some hupo, which is amber powder, and she took it in about a half hour, but their hours were two of our hours. So in about an hour, she loudly belched twice, and he was happy about that. He loved her belching. He said, "Ah, the clear yang is moving up, which means the turbid yin will descend. And from now on, she will be peaceful." In the night, more lokia was discharged. She also had a bowel movement, and then she demanded rice porridge to drink. So I asked her, "How were you speaking Mandarin yesterday?" And she said, "I don't know," because she was channeling Guanyin or something like that, but he didn't want to believe it. Anyway, he's not done ranting. He goes on and says, "Gentlemen, I began to believe that this pattern of stored up blood along with speech as if seeing ghosts is not a false accusation." In other words, he may have heard about this before and thought it was weird, but now he's seen it with his own eyes. So seeing is believing. And then he goes on, "In former times, Qin Yue Zhen," which is the name of Bian Cui, a famous legendary doctor pre-Han, Warring States period. So, he's quoted in Shiji, the historical records by Sima Qian. So Bian Cui is quoted as saying, "There are 6 types of patients you should never treat. And one of them is trusting Wu or shaman, but not trusting E or doctors is one type of untreatable patient." So now he's saying the woman doctor is a shaman. Well, yes, I mean, he accuses her of giving herbs. He called her an E doctor before, but now he's saying she's a shaman. The ancients said that using herbs is like using an army. For example, look at the bright wisdom of General Guo Zi and eunuch Yu Chaoan, um, supervising the general even though this General Guo was really a good guy, he couldn't succeed because the eunuch was in charge and was doing the wrong stuff. So, here's a picture of the general and here's a picture of the eunuch. And of course, he hates the eunuch and loves the general. He says, "Oh, I'm not really comparing myself to Commander Guo. Oh, how could I ever do that? He's so much above me." But of course, he thinks he is that person. But the mistakes of the female doctor are even worse than those mistakes that the eunuch made. So, alas, how can one fail to be cautious? So he's comparing the woman doctor to a eunuch, and he's comparing himself to this general who was stymied by the eunuch, even though in the end she seemed to recover. So here's just a little bit more information about that historical situation. So, this is a Tang Dynasty situation, and General Guo was a really important general that should have won all of his battles, but the evil eunuch, was portrayed as a selfish schemer with evil intent, and the general was a brilliant, impeccably moral person, and so of course this is so gendered. Well, I'm sure there were evil eunuchs, and I'm sure there were good generals, but eunuchs are always portrayed as being like bad. But who made them a eunuch? I mean, they didn't, for the most part. Yes, some chose, but for the most part, eunuchs were boys that were captured when, from some enemy when they were, pre-puberty, or a family in, extreme poverty would sell one of their sons to become a eunuch. It's not the eunuch's fault. And if I were a eunuch, I'd be a bit resentful, wouldn't you? So anyway, he implies that she was a shaman, not a real doctor, even though he called her doctor before. And you might notice that even though he blamed the woman doctor for everything, his own medicine, he said, oh, this wasn't affected. I better change my formula. And then he starts using some of the stuff that she used. So anyway, that's Sun Yikui. I really like this case because, the poor female doctor and this woman who's channeling Guanyin. Anyway, that's my case.